BMP-2, as I said, is a bone-inductive molecule. Clinically, it's used predominantly in spinal fusion, so where you have intervertebral disc disease or collapsed discs, then to address the pain that comes from those conditions, one of the most effective approaches to addressing that is to fuse vertebra. So there's no more movement, but there's support there, so you don't get that pain. And so that's a very common procedure, and there's a big market. And BMP-2 is used in that context really to stimulate bone where it wouldn't normally grow. And that's really the power of the molecule. If you inject BMP into your muscle, it turns your muscle into bone. It's very potent. And it's used very widely because it's one of the only really effective ways of actually stimulating fusion reliably, especially in elder populations. But as I said, there's dangers associated with it. So currently, in the current clinical product, its concentrations at which it's used are very high. There's often issues of swelling or bone loss, as a result. And that means that the clinical context where it's allowed to be used is quite limited. For example, it can only be used in the lower spine, lumbar spine, not the cervical spine. And so I think probably our first target will be to demonstrate improved safety, efficacy at lower doses, and hopefully open up the molecule's use, not just in the lower spine, but also in the upper cervical spine. And then there's the additional advantage of having an injectable material. So talking to surgeons, it's at least feasible, it's not currently practiced, but it's feasible that this could one day be an outpatient procedure where you can deliver these molecules in a minimally invasive way. And so that's the other application we really like to pioneer with this material.